Hello everyone, welcome to Nurses Said. This is a brand new episode of this channel, and of course, today we'll focus more on having case scenarios and case analysis. And of course, I think this will be very beneficial to those nursing students. And of course, this will also guide the faculty with regards to how to create their own case scenarios and case analysis among their students, especially with our virtual classes today. This will be the beginning of Chunket Nurses series. That question mark will be answered after we will actually be done with the case analysis this evening. Critical thinking cases for virtual learning, we will be focusing more on dementia today, and this will be the beginning of Nurses Chunket series. Case scene 1. You are the nurse working triage in the emergency department. This afternoon, a woman brings her father, KB, who is 72 years old. The daughter reports that over the past year, she has noticed her father has progressively had problems with mental capacity. These changes have developed gradually but seem to be getting worse. At times, he is alert, and at other times, he seems disoriented, depressed, and tearful. He is forgetting things and doing things out of the ordinary, such as placing the milk in the cupboard and sugar in the refrigerator. This morning, he thought it was nighttime and wondered what his daughter was doing at his house. He could not pour his own coffee, and he seems to be getting more agitated. KB reports that he has been having memory problems for the past year and at times has difficulty remembering the names of family members and friends. His neighbor found him down the street 2 days ago, and KB did not know where he was. A review of his past medical history is significant for hypercholesterolemia and coronary artery disease. He had a myocardial infarction 5 years ago. KB's vital signs today are all within normal limits. Chunket question. What are some cognitive changes seen in a number of elderly patients? Chunket answer. Of course, the common problems with elderly are loss of short-term memory and accompanying benign forgetfulness. Another, poorer performance on complex learning tasks, and lastly, slowing of the thought processes. So these three are common problems among elderly patients. Chunket question. You know that physiologic age-related changes in the elderly can influence cognitive functioning. Name and discuss one. Chunket answer. Decreased visual acuity and accommodation can result in decreased ability to process visual cues. Yellowing and flattening of the cornea can lead to difficulty distinguishing colors. Another one, fewer functional cochlear cells can lead to decreased ability to process auditory input. Chunket question. For each behavior listed, specify whether it is associated with delirium or dementia. First, gradual and insidious onset. Second, hallucinations or delusions. Third, a sudden acute onset of symptoms. Fourth, the functional impairment is progressive. Here are the answers. For letter A, dementia. For letter B, delirium. For letter C, delirium. And for letter D, dementia. Another lists. A, inability to perform ADLs. B, incoherent interactions with others. C, patients may demonstrate wandering behavior. And D, behavior disorders often worsens at night. Here are the answers. For letter A, delirium. For letter B, delirium. For letter C, dementia. And for letter D, delirium. Truncate question. Based upon the information provided by the daughter, you think KB is showing signs of delirium or dementia? Explain. Dementia. The onset has been gradual. He has had progressive cognitive impairment such as forgetting things, placing milk in the cupboard, wondering about his daughter, unable to pour coffee, difficulty remembering names, and he has shown wandering behavior. This behavior does not show the sudden onset such as hallucination or incoherent interactions that are more likely to occur with delirium. A distinguishing feature between dementia and delirium is the onset, with dementia demonstrating a slow onset, whereas delirium has a sudden onset. Truncate question. You know that there are 4 main types of dementia that result in cognitive changes. List 2 of these types of dementia. We include Alzheimer's disease, diffuse Lewy body dementia, frontotemporal dementia, and vascular dementia. Truncate question. How can the level or degree of the dementia impairment be determined? Truncate answer. A psychologist determines neuropsychological testing in the major domains of thinking and memory, verbal and expressive abilities, constructional skills, and executive functions. This information helps determine whether the patient can continue to handle his or her own finances, driving, or individual activities of daily living. Truncate question. A number of diagnostic tests have been ordered for KB from the test listed, which would be used to diagnose dementia. Mental status examinations, toxicology screen, mini mental status examination, ECG, EEG, CMP, CBC with differential, thyroid function tests, colonoscopy, RPR, serum B12, bleeding time, HIV screening, CT scan, and MRI. Truncate answer. Only the ECG, colonoscopy, and bleeding time would have no relevance in diagnosing a dementia disorder. Case in 2. After reviewing KB's history and diagnostic test results, KB was diagnosed with Alzheimer's dementia. The physician calls a family conference to discuss the implications with KB and his daughter. Truncate question. What neuroanatomic changes are seen in individuals with Alzheimer's disease? Truncate answer. Changes seen in the brain include destruction of the proteins of nerve cells of the cerebral cortex by diffuse infiltration with neurofibrillary tangles and plaques. That's your non-functional tissue. These tangles and plaques are a result of the death of nerve cells within the brain. Truncate question. List at least 3 interventions you would plan for KB. First, truncate answer. Educate his daughter and other caregivers about providing a safe environment at home for him. This includes such things as not allowing KB to cook alone, examples given: unplug the stove, conducting a risk assessment for falls, and not allowing him to go out alone if he is prone to disorientation. Another one, provide orientation aids such as calendar and clock. Third, educate the family about support groups and online resources for caregivers. Third, instruct the daughter to not allow KB to drive alone. Educate her that he might not be able to drive at all as the dementia progresses. Next, instruct the family to keep environmental stimuli to a minimum. Maintain a daily routine. Do not vary activities from day to day. Next, refer the patient to his primary caregiver or primary care physician for possible medications, which can slow the progression and improve daily functioning when started in the early stages of dementia. Case Scene 3. KB is discharged and sees her primary physician. 2 days later, KB receives a prescription for donepezil or your Aricept 5 mg PO per day at night. As you review the medication with KB's daughter, she tells you that she is excited because she did not know where medications that could cure Alzheimer's disease. Chunk it question. How do you respond? Chunk it answer. Gently explain that medications like donepezil are not cure for Alzheimer's disease, but they can help relieve symptoms and or allow the progression of memory loss. Case Scene 4. 2 weeks later, KB's daughter calls the physician's office and states, I realize that the Aricept will not cure my dad, but there has been no improvement at all. Are we wasting our money? Chunk it question. What is the best answer for her question? Chunk it answer. This medication might take 4 to 6 weeks for an improvement to be noted. If, after that time, no improvement is seen, the dose may be increased to 10 milligrams per day, but for now, she needs to give the medication more time to have an effect. Critical thinking cases for virtual learning, case closed. See you again. This has been Nurse Jose. You can reach me with my contact details and social media accounts. Nurse Jose, at your service to make your best better. Thank you. See you around.